Hey everyone, this is Dr. Ammar from Elite Orthodontics, and we are having a great morning. I love to start a series of videos about Invisalign. There's a lot of questions comes about Invisalign and how to do treatments efficiently with this. The whole goal of this videos is to share my experience and knowledge about Invisalign. There's so many tricks to learn about this system, and if you know them and you do them well, you will decrease a lot of the headache about doing multiple refinements, long treatments, and posterior side effects, etc., etc. So we will switch the camera to the computer, and then you'll be able to see some good tricks while I'm talking. And today will be case 1, which is a simple anterior open bite case. And those are actually a simple cases using Invisalign, knowing the fact that Invisalign is actually a really good tool to treat very small anterior open bite. So I'm gonna flip the camera right now, and I will be continue to talk, but you're not gonna see me. See you maybe next time. Thank you. Dr. Ammar from Elite Orthodontics again, and we are now looking at the computer screen. I know that's not the best video quality, but I think it's clear enough to tell what we are talking about. I want you first to take a little glance about the staging of our cases. This is a very simple case. A case was treated long time ago with Invisalign, and the open bite relapsed, which something we know that it always happen because of the less stable outcome with anterior open bites. As you see, there are 4 aligners of treatment, but there's the brown line, which is the overcorrection. I have about 10 aligners, and I will get to talk about them just in a minute. So first, let's start talking about what's the treatment goal. So we're looking at this case. I always go side to side, and I will go I'm going to the back to the start, and I'm going side to side and see the bite in the back looks pretty good. It's a little bit of an increased buccal over jets, and we'll work on this. But the most importantly, that we see an anterior open bite, especially at the natural incisors canine area. So the goal now is to actually extrude them and intrude posteriors to get a stable treatment. Now we know extrusion is not the most stable movement, so you always want to do as much as possible posterior intrusion to rotate the lower jaw to the upper jaw and get a more stable anterior bite closure. Now another factor comes into this is where are the incisors to the lips, how the gum line to the lips. All the factors make us decide which teeth need to move more into where to continue to have that cosmetic and aesthetic looks. So I will start with the attachment placements. In this case, I put the attachments a little bit more gingival because the patient doesn't want to show any more attachments. So we told them we will try with this style of attachments, and if they're not working, we're going to redo it with the attachments actually in the center of the crown. You can do as much refinement as you want. Now, in this case, you could see what kind of attachments I use. Sometimes Invisalign gives you those default smart double attachments. I didn't notice that they work pretty well, so I still use the old school gingivally beveled horizontal attachments. And the reason we use the gingival bevel, and I will talk about this a little bit right here, is the gingival bevel give you that slow continuous movements on this side. Sometimes people think that the attachment works on this side because it gives a lock. So if I flip that attachment, it will give me a better lock of the aligner on the attachment. But that's actually not true, even though it makes sense. What really true is you want the attachment to be that beveled, because that's the direction of the movements we want, is to go down. So when the aligner going to go in, it probably is not going to fit perfectly. It will have a little clearance around here. But that long slope of contact between the attachment and the aligner attachment gap will give you that slow extrusion movement, and guarantee you that you will not should worry ever about the aligner not even gripping into that attachment. Well, if you flip that attachment the other way, it's either going to go in or the attachment is going to be skipped from the aligner, and you'll have a lack of track situation. So now we know why we did those attachments, to extrude those anterior segments. The other trick is doing In this case, I have a little bit of a class 3 bite. You can see that canine is a little bit backwards, and we need to do a little bit more class 3 correction. But in this case, because it's an open bite, I make sure all my elastics are working in the front area. And this way they do class 3 correction on the horizontal side, but they do bite closure. If you put this elastics cut out here on the molar, you will have a vertical component that actually extrude the molar, which can lead to way more anterior open bite in the front. Even though it's a very small in Invisalign, because of the plastics layers on the posterior segment, which they constantly works to intrude the posterior segments and close the anterior bite. But I will still be careful, and I'll put the elastics in the front segments, and that will help both class 3 correction and anterior closure. Now, to add to all of this, the most important part is this. You'll see that I did attachments on the tips of the upper mesiolingual cusp, sometimes on both of them. It all depends where the occlusion is. Now, this attachment is not going to be filled. It's just going to be a bump on the aligner. This is very important. So when the patient wears the aligner, there will be a bump. When they bite, they're not going to be able to bite all the way. And this bump will push the molars even more and give us more of that desired side effect in an open bite case, in this case. Because in a deep bite case, this is actually not desired as side effect, and we want to actually get rid of it. And I will show you how we do that in a more educational videos in the future about deep bite treatments. But going back to this will help to guarantee further more intrusion in the posterior segments. And now we're gonna go to the full set again, but now I'm gonna be talking about the overcorrections. As you see here, this is our perfect finish, but I still have another 10 aligners all the way to 14. So what are those? I'll tell you what are those. Those are my secrets in a lot of my cases to avoid a lot of refinements. The first 3 aligners will be rotational overcorrection. I'm gonna zoom in more, and I want you to watch what happened to the incisors. And this is to over-rotate teeth that started with the minor rotations. I go the other way with rotations because we know Invisalign doesn't do the job really well, because aligners are just weak. So we have to do this. Otherwise, you're gonna have a small in and out between incisors, and you're gonna have to do another scan or impression and wait another 4 to 6 weeks before you start your second refinements. So if you have those in your box, you can use them when you need them. You don't need to use them all the time, but you have them when you need them. Once you're done with that, to guarantee that we did not over-rotate any tooth, which never happened to me, by the way, I have 4 more aligners. As you see, I'm paging through them. They're all the same. They are exactly similar to aligner number 4, which is a perfect finish. Why I do 4 of them? Because of multiple reasons. Sometimes we have a posterior open bite that we wanted to take care of, and I got a sneeze, excuse me. Good, back here. So I'm gonna look at the occlusal of this case. So let's say this is, let me look at the sideway. So the clean check shows a perfect bite in the back. Sometimes we actually finish with a bite, not a little bit open in the back. So what I do, I cut one of those aligners right in front of the first molar. And I see the patient in 2 to 4 weeks. Wait until the molars settle. And that's important, not just for the bite, it's actually important for TMD, because if we have a light posterior contact, our muscles will push or pull our joint hardly on the disc, and a lot of those patients will suffer from a little bit of soreness in their TMJ joint. So we want to make sure that we give them a stable bite before they go toward retainers and leave our offices. So I use those 4 aligners to get that bite settled. Some patients takes 2 weeks, some patient takes 3 months. That's why I have 4 sets, and sometimes I have to cut to the first molar, so I allow the second molar to settle as well. And then the last stage of it will be the space closure. So you can see at the end, we will be closing spaces. Now, do I use this all the time? No. But typically at the end of the treatments, I will go there and start flossing to check contacts. If the contacts are loose or not tight enough, then I'll use those aligners. If the contacts are pretty good, don't use those aligners, because what happens when you push the teeth together and there's no space, you will crowd the teeth again and make them crooked again. So again, those are my finishing stages. Those are very important tricks. If you learn them, you will do great in your Invisalign cases. Thank you so much for listening, and have a great rest of the day. Don't forget, like us on Facebook, Elite Orthodontics. Follow us on Instagram, because we're going to post a lot of those videos there as well.